Okay, this video is who is the best doctor in the world. This painting right here is St. Peter healing the sick. As he walks past the lame and the sick, they start to stand and become healthy. It's a famous painting by Masaccio from 1425. Okay, now who's the best doctor in the world? If you go to most hospitals, university hospitals or something, usually they'll say someone is the best doctor in the world if so-and-so has generated the most money for the hospital, like a plastic surgeon. You know, that'd be a fun job. You can make a ton of money and it's kind of glamorous and women love those guys, so I'm kind of jealous of them in that way. A doctor sometimes is said to be the best doctor at a university if he's published the most papers. But the point I want to make when I use this term, the best doctor in the world, is who is the most able to help people? Who makes the biggest difference in a significant way in the largest number of patients? And when you look at it that way, it has to be the doctors that are experts in nutrition, because the vast majority of diseases are due to the modern diet, hypercaloric malnutrition, high calorie, bad diet. Another thing that's not well recognized, but it's starting to become more recognized, is tons of diseases are due to toxicology, and that means harmful chemicals in the food, in the air, and also in the environment. Things like BPA in plastics, the phthalates in plastics, and that is highly relevant to health. Okay, so Dr. John McDougall, he knows the nutrition literature the best overall of any expert in the entire world, especially for the 1900s. He's got about 47 years of experience with internal medicine and nutrition problems, talking to patients about these things. He's written a great, he also has good historical knowledge with his experience with Dr. Kempner, Drs. Burkitt, and with Nathan Pritikin, etc., and Heimlich, etc. A lot of great stuff. He's written a great newsletter for many years, several excellent books, and he's made many great videos, provides a coherent rationale. That's what you really need, I believe, is you have to understand all animal products are bad. That way you know what to do when you're offered another one, okay? All dairy is bad. You have to get that to move to the higher level of nutrition knowledge and thinking. So, and McDougall tells the truth. I've never caught him intentionally BSing or lying, not once. So, do I think he wimps out on some things? Yeah, maybe everybody does, okay? But I think overall, and really I've thought about this a lot for decades, Dr. McDougall is the best doctor in the world, okay? I think that's pretty clear, actually. So in terms of the most knowledge that's able to help the largest number of people in a very significant way. I think he's proven that and done that for a long time, and that's great. Who's the second best doctor in the world? And so first thing is, a lot of people are saying there's all these nutrition experts, and I know there's a lot of very smart, very knowledgeable nutrition experts out there. But what I've also noticed is lots of them are selling stuff, and they're biased to promote the stuff they sell. And I think that damages their credibility. There's also a lot of them out there who are promoting stuff that I think is obviously bogus, okay? You could pretty quickly find about 30 papers. Let me say, you could very quickly find, 20 papers showing problems with soy. And then if you look a little harder, you'll find a whole bunch more. And there's a lot of people that are promoting soy as if it was some type of miracle food, okay? And caffeine, okay? Caffeine is terrible. I mean, it just mimics stress. Everybody knows stress is bad for you, excessive chronic stress. And there's people out there promoting caffeine, olive oil. As soon as somebody promotes olive oil or the Mediterranean diet, they're full of crap, okay? It's pretty obvious. So I'm just telling you, these are ways you could tell if somebody knows what they're doing, or if they're telling you the truth, or if maybe they're biased for some reason or being paid to promote something. It's obvious. Olive oil, fish oil, caffeine, soy are bad foods and should be avoided. All right. If you dig into the literature and you spend a couple days, a 3-day weekend, all day long reading about these things, and it'll become clear. All right. And it takes more effort to show there's a problem with nuts because of the excessive amount of fat, but it's there. Flax requires more study, but at this point, I think it should be avoided because it's high fat, it's highly super duper estrogenic, and it even, thought to have some cyanide-like chemicals in it. I don't touch that stuff. All right, now there's other doctors who everybody knows, and they are great. Dr. Esselstyn, for coronary artery disease prevention, T. Colin Campbell for the association between protein and cancer. They deserve Nobel Prizes, okay? And, super duper best in the world expertise in a specialized field. That is something deserving of a Nobel Prize. It really helps a lot of people. But I think to some extent, they're a little bit one-trick ponies in terms of not going into everything, other aspects of nutrition and toxicology. Now, don't get me wrong, T. Colin Campbell's going into a lot more variety of detail than Dr. Esselstyn has. But I would say, and now of course, anybody could contest this. I'm happy to hear what you have to say. I think I'm the second best doctor in the world based on this criteria, which of course I made up myself. I got nothing to sell, so I don't promote anything. I got nothing to promote. I got no sponsors. I have nothing to recruit for. I'm kind of just showing off because I'm bored. My regular work, I kind of, work like a typical doctor on a factory assembly line. I just crank out billing codes, and I try to do the best job I can, and I really do try to do that, but you really can't distinguish yourself that much in conventional medicine because it's primarily based on quantity, not quality. You just meet the standard of care, generate your billing codes for the day, go home. That's what a regular doctor does. Whereas this nutrition and pathophysiology is the wild open frontier of medicine and health. And it's where most of the disease is. And it's really ridiculous that conventional medicine doesn't know anything about nutrition or toxicology. Also, I believe in God and have a biblical worldview that man is created in the image of God, therefore partly divine as well as part beast, of course. But what this means is my religious worldview obligates me to tell the truth. Okay, so I want to help the proles, the plebes. Okay, and so I'm obligated to do that because I wouldn't respect myself if I didn't, and I wouldn't have any right to call myself, a great doctor if I didn't do that, and I want to. I mean, I don't got much else going on for me in my life. My kids are grown up. I don't spend much time with my wife. I'm bored, okay? I sit around doing this because I think it can really make a difference and help people. All doctors are trained in internal medicine, okay? Every single doctor knows the basics of internal medicine and did some during their internship. So everybody knows that stuff, and Dr. McDougall's an internist, and that's where most nutrition experts come from, is either internal medicine or internal medicine-based subspecialties. And so they have this shared amount of knowledge that basically all doctors have. And what I'm trying to say is I have a lot of knowledge that comes from way outside that spectrum. I have a deep interest in biochemistry and toxicology, and tons of diseases related to subtle, often complex issues in biochemistry and toxicology. And I've searched all over the internet. As far as I can tell, there's nobody remotely anywhere close to my level of information provided on biochemistry and toxicology as it relates to nutrition and disease and pathophysiology. Also, the big difference I see is, internal medicine is primary care. They talk to patients a lot. And internal medicine is subspecialties. Whereas I talk to patients and relatives and friends and stuff a lot about nutrition, but my main focus typically is convincing other doctors about nutrition and pathophysiology. So I'm very much used to digging deeper into the nutritional and pathophysiology and toxicology, biochemistry literature to be able to convince my doctor friends and colleagues. So I don't just stop at saying this is the way it is, this is my opinion. I'll try to get you the papers to show it and say go look for yourself. Okay, so I have deep interest in pathophysiology. 333 students in my med school class. I was the best student in the class in pathophysiology, biochemistry, and probably most other things. My training is, diagnostic radiology. I know anatomy backwards and forwards, and most doctors really don't know much anatomy. You'd be surprised. Strong surgical background, surgical internship, endovascular surgery training for years, including neuroendovascular surgery, brain surgery, general radiology. I'm not a brain surgeon, but I almost was an endovascular transcutaneous brain surgeon. It's a long story, but I decided not to go down that path because neurosurgery's taken it over. So I've got all this unique background. Pain management. I ran a pain management spinal injection clinic for years. So I got a lot of weird high-tech experience that I think is helpful. I don't just trust a paper when I read it. I can tell if they're telling me the truth or bullshitting me about the imaging and surgical issues. I was a pretty serious athlete when I was young, so I'm very interested in not just being healthy enough for some average patient. I'm interested in the top possible athletic performance and also cognitive performance. I just got 99s my med school and residency boards, and I'm very interested, and I've always been, in what is the absolute best intellectual performance a human is capable of. And then studying nutrition from the point of view of the brain is different than from the heart. Most doctors focus on preventing heart disease. And yes, that's wonderfully important. It's the most common cause of death is myocardial infarction. But the brain is a lot more fussy. There's a lot of things that are toxic to the brain that are essentially irrelevant to the heart. And so the fact that I'm always trying to figure out things relative to the brain has got me to spend a lot more time studying things like what causes dementia, what are the excitotoxins, what is the deletory theory of cognitive impairment. I invented my own theory, the neurovascular uncoupling theory of dementia. Okay, that and deleteria are the two best theories of dementia. I invented the spine theory. Other people have been aware of ischemia as a cause of spinal degenerative disease, but I'm the one who figured out it's not just lumbar spine degenerative disc disease, but it's the entire spine, lumbar, thoracic, and cervical, and it's all connected. Degenerative disc disease, DISH, and OPLL and OLF, all that stuff, it's all connected, and it's all primarily due to ischemia, but also GP and F minus. So anyways, that's my point of view on the thing, and I'll try to help whoever wants to be helped. I got about over 530 lectures now on YouTube. I got a whole bunch more on other video channels, but YouTube's the main spot because it's got the biggest audience and it's got the best software for doing all this stuff. So anyways, I hope it's helping you. If you want to dispute this, go ahead, dispute it, and I'll learn from it or challenge it or whatever. Okay, thanks.